proceed. Senator Cornyn.
Thank you, Mr. Secretary. Last year, approximately 108,000 Americans died of drug overdoses, including 71,000 roughly from synthetic opioids like fentanyl. Do you believe we have a public health crisis when it comes to these overdose deaths?
Oh, absolutely, absolutely.
And one reason why we have this public health crisis, which you and I both recognize as such, is because we've lost control of our southern border. We've seen millions of people show up, some claiming asylum, some being placed like unaccompanied children through your offices with sponsors in the interior. And of course, the asylum system now, which essentially is a free pass into the interior of the United States, and due to the backlog in the immigration court system, many of these cases will never be reached, assuming people actually show up for their immigration court hearing in the future with very little consequences. As you know, Title 42, which is the public health title that was implemented because of COVID, will expire in May. I'd like for you to tell us what the administration's plan is to deal with this public health crisis and this humanitarian crisis caused by the lack of any controls of our border.
And Senator, I will try to concentrate my comments on the work that we're doing at HHS, and I'll let my colleagues speak to the work that they're doing, for example, Department of Homeland Security and others, on other aspects of this.
Well, I'd like to know what the plan is. I assume you've been consulted and collaborate on that plan, but so far we've not seen anything that is credible in terms of dealing with this. And as bad as it is now, which has never been worse when it comes to the flow of drugs and people across our border, it will get worse if Title 42 expires and there's not an adequate plan put in its place to deal with both the flow of drugs and people.
And to your point, because we're having to work under a very broken immigration system, as you mentioned, these are the things that happen. I know that, for example, the Department of Homeland Security is trying to move the asylum process in a way that lets us get to these cases quicker and adjudicate them, so that way we can move through that process. But in terms of HHS, we continue to try to be prepared because we don't know who will cross that border as a child who's unaccompanied, and when we have to be ready to secure them from DHS within 72 hours so they can be in an appropriate setting. And so what we're doing is preparing whatever the eventual outcome is to make sure that we respect the rights of any child to receive care that's essential, and we're going to continue to do that at HHS.
Well, Mr. Secretary, I'll just give you one person's opinion. I think the Biden administration has completely dropped the ball when it comes to the border, and unfortunately, we've seen all of these deaths. I went recently to a high school right outside of Austin, where I live, and talked to the parents of who've lost young people who thought they were taking something relatively innocuous, but it was laced with fentanyl. And as you know, the cartels use industrial-type pill presses to make what looks like a normal pharmaceutical product, which in fact is tainted with fentanyl, which, as you know, is extraordinarily powerful, and small amounts will kill. I want to just say the one thing I would congratulate the Biden administration on is their commitment to implement the bipartisan Safer Communities Act. Senator Stabenow acknowledged what one of the most important parts of that bill that Senator Tillis and Senator Sinema, Senator Murphy, and I were involved in, and actually all of our colleagues were involved in one way or the other. But we've made the single largest investment in community-based mental health care in American history. And I think that's something that we're all going to be very proud of and will address a huge unmet need. But the last thing I want to say in the few seconds I have is just to ask for your help. Senator Menendez talked about the workforce shortages. Nowhere is that more apparent than in the mental health and physical health delivery systems. We tend to focus, like through a soda straw on reimbursement rates because the federal government is trying to figure out how can we cut health care costs, make it more affordable. But we have a confluence of problems when it comes to recruiting and retaining health care professionals. We have erosion of the standards for providing those professional services through scope of practice issues. I would like to ask whether if you'll be willing to work with us, particularly the chairman, the ranking member, obviously set the agenda, in working on all of these issues as part of the same problem as opposed to dealing just with the reimbursement issues in isolation.
Senator, we'll look forward to hearing from your staff so we can follow up with you. This is absolutely something the President has asked us to follow and work on. The President does dedicate monies to workforce expansion and development and also resilience. So we'll look forward to working with you on this.
Thank you.
Senator Cornyn, thank you again for your leadership, your ongoing leadership on these mental health issues. And I think there's some more opportunities, particularly for public-private partnerships. In our part of the world, Connie and Steve Ballmer have funded behavioral health studies at the University of Oregon. I think it's going to be a model for the country to get more workers. So look forward
Mr. Chairman,
to
as you know, it was the product mainly of this committee, the Finance Committee, that made that possible as part of the bipartisan Board Safer Communities Act. So thank you for your leadership as well as that of Senator Crapo. I think that's a big deal.
To be continued.